If you've been wondering whether you should get orthotics or whether that is the wrong thing to do and they're going to weaken your feet and make things worse in the long run, then this video is for you. So why should you listen to me talk about this topic? So my name's Dr. Narelle Wyndow and I'm a podiatrist with a PhD in human movement science, also a master's and a graduate diploma in human movement science. This is my thing. And I've got over 30 years of experience treating patients with chronic foot problems, and I have a particular interest in foot and ankle osteoarthritis, so those more chronic musculoskeletal considerations. The thing I would say about the use of foot orthoses and whether they are good or bad is that it depends on what you've started with and what you currently have or are suffering from. For example, if you were born with particular foot shape issues, there are some skeletal structures that you have no choice in, that you can inherit, that can make you move in such a way that you're more predisposed to having problems with your lower legs, so your hips, knees, foot and ankle. Or if you've sustained an injury through sport or work or just bad luck, then you are also going to be moving differently, usually in a way that is not great for your joints, muscles and tendons. And the other aspect is if you are older and you are unfortunately genetically predisposed to osteoarthritis or have post-traumatic osteoarthritis, then these are all completely different scenarios where it's not black or white as to whether orthotics are going to make your feet weaker or whether they are bad for you. If you look at the literature, and it's very easy to do these days, anyone can go onto ChatGTP and put in a really good search query asking ChatGTP to not hallucinate, check all its references, and you will notice very, very clearly that there is research looking at asymptomatic people using orthotics, usually an immediate effect study, to look to see if foot muscles work differently when using foot orthotics. And there is a couple of small studies that have looked over a longer period of time in asymptomatic individuals whether foot orthoses reduce muscle volume, so the size of the muscle, or muscle strength or muscle activation. And in these populations that don't have any foot problems, the muscles often don't have to work as hard with a foot orthotic in place, and other muscles will actually have to work harder. So the posture change from a foot orthotic changes the orientation of some muscles and their tendons, and it changes how these muscles work. It doesn't switch these muscles off. Some work harder, some work less. The muscles that we can access in the feet to measure are only a few of them, and we can't see what all of them are doing. So this is the other limitation we have with science as it stands. And as I said, my other career, if you like, is this interest as a scientist in how we move, how we walk, and EMG in particular, or neuromuscular control. So my graduate diploma looked at how the brain controls movement, how it responds to sensory information in to change the motor output that goes out to your muscles and changes how you move. So if you're a healthy individual, you don't really need to mess with that. You don't need to necessarily change your foot posture. You don't necessarily need extra information for your brain to work out how to move well. You probably already move pretty well. If you have a foot problem, a chronic foot problem in particular, this is a whole different ballgame. It's completely different. You cannot use these existing studies to say that foot orthotics are bad for everyone. It's a bit like saying, glasses, I should just take these off now and I can't see very well now, and that people who need glasses should just do exercises and toughen up and not use an external aid. We all know what would happen. If you wear glasses and you're not wearing them to try and read, it's very difficult to function. Your eyes can't function well. And it's the same if you have a foot problem. So it makes no sense to me to say to somebody who is in pain, who already has limited function, to take foot orthotics off or to not get them in the first place. That is madness. And look, in my books, that is almost negligent, because you're actually almost doing that person harm. I have a situation at the moment where I have an older patient. He's had an ankle replacement and he was doing quite well with specific or prescribed footwear and foot orthotics that we gave him. His ankle wasn't swelling, he was able to walk relatively confidently post ankle replacement, and yes, they are a thing. And he went to see a physio about some balance concerns. He's older, he's having some other neurological concerns that are impairing his balance. And the physio said, look, those shoes and those orthotics, they're impairing your feedback from the ground. And that is true. You can't feel the ground with thicker footwear and foot orthotics on. And the physio told him to not wear those shoes and not wear those orthotics. And what happened is now his ankle is swelling up and is painful. So he now no longer can walk as far as he would like to. He is still a falls risk because now he has pain inhibition, which is where the pain from the area, from the ankle, is inhibiting his muscles' capacity to engage. It's a protective mechanism. The spinal reflexes do actually. It's not actually a brain thing. So while the physio had good intentions, asked the patient to feel the ground more without thick shoes, it actually wasn't improving his pain. It wasn't improving his function, and nor was it actually improving his falls risk. So you need to look at these things in context with an open mind as to all aspects. So with this patient, the important thing to consider is that he does need to have information coming into his brain, and that the orthotic and the shoe must provide good quality information. The last thing a patient like this should have is a soft, squishy shoe. They're going to decrease the quality of the information coming into the brain for the brain to use to coordinate his movement. An orthotic can be manipulated not just to try and improve the stacking of the ankle joint so it can hinge better and move better. It's a very mechanical thing in this instance with a joint replacement. But also the orthotic can have additional lumps, if you like, on it to try and give the brain specific information about the foot as the body weight moves the centre of mass in different areas as this person moves forward. So foot orthotics and support footwear have a really, really important role if used correctly in the right people. It isn't you should do strengthening or you should wear foot orthotics. It's not an either or thing.